all my dear aspirants for the INI-CET MDS exam for the July 2024 session. Today, standing at the 19th of April, we have exactly 1 month to go for that big exam which will get you a seat in the institutes of national importance. AIIMS, PGI, and this time one seat in JIPMER. So I am here to tell you today what should be your strategy for the last 30 days of your preparation. Most of you are well prepared. A lot of you have given the NEET 2 months back or 1 month back, have got your results. Some of you are satisfied with your result and you want to give INI a chance. Some of you are not satisfied with your result and INI is your, a very big hope for you. For all of you, the strategy remains the same. 30 days, your strategy should be 1 paper per day, 1 test per week strategy. Okay? So today I'm here to discuss with you how you will make this strategy work. It's very easy to say 1 paper per day and 1 test per week. When I say paper, I mean the PYQ papers, that is the previous year INI-CET papers. And what do you do with these papers? Read the question, read the answer, that's it? No. Read the question, guess the answer, and if you are sure about the answer and all the topic around that answer, then you move ahead. If you have guessed the answer, or if you are not sure why this is the answer, or if your answer is wrong, then you read the full explanation of that question. Unless and until you understand the whole explanation or the whole topic around that question, your doing of paper is useless. If you revise your paper, it will be only considered as first revision, second revision, third revision if you know everything about that topic. And just like INI-CET, just like NEET, paper is repeated. Questions are repeated. Topics are repeated. If there is a question on mandibular fracture, there can be a same question with the same image on mandibular fracture with a little twist in the options. So unless you know everything about that topic, your reading of the paper is incomplete. So older papers of AIIMS have 90 questions. The latest INI-CET pattern papers have 200 questions. So minimum you have to do 1 paper. You have to do minimum 200 questions with the explanations. If you are very sure about the answer, if you are very sure about the reason for that answer, you think you don't need to read the explanation, it's okay, you can skip. But if you're not sure about the answer, do go and read the explanation. The next important thing is test yourself regularly. Whichever study, whichever exam topper you find, you will always realize that they have been testing themselves again and again and again. If you can test yourself more frequently, it is awesome. If your preparation is set, if all your subjects are done, and you just need to give tests, it is great if you can give more than 1 test per week. But at least once a week, you have to appear for 1 grand test. So 1 month to go, 4 weeks to go, at least 3 to 4 grand tests you have to give. Grand test means full syllabus tests. Because it is not just about knowing the answer. It is also about knowing the answer in the right frame of time. Using your 180 minutes to answer 200 questions without mistakes or with minimum mistakes. Remember, in INI, there is a +1 and a -1/3 as compared to NEET, where is a +1 and -1/4, a smaller negative. In INI, it's a bigger negative marking. So you can't afford to be wrong. just because of time was less, just because I was in a haste. You can't afford to make mistakes, especially in the previous year questions. So to test yourself, whether you're able to finish the test on time, whether you're able to finish 200 questions in 180 minutes, you need practice. So one paper per day, one test per week is the strategy which you have to follow. Now, how will you divide your day? How will you spend your day in doing these things? I have made a crude timetable including all the subjects that are there. If I have to divide the time from 19th April to 18th May, this is how I have done the division. Okay, all the 19 dental subjects along with anesthesia. I can split my day into morning and evening. That is the first half and the second half. In the morning, I will do the subject. Whatever questions I don't know from that subject, whatever notes I have made which are important, that theory and those notes you have to read in the morning. Start with a basic subject, blend it with a clinical subject. That makes it more retentive. So I have made anatomy followed by oral and general surgery. I have purposefully put anesthesia because for INI, anesthesia is very, very important. Airway techniques, airway routes, airway methods, airway drugs, the GA drugs. Anesthesia is a very, very important part. Surgical intubation, non-surgical intubation, fiber optic intubation. Give special time to your anesthesia notes. Alright, then ortho and pedo because they have a lot of appliances which are overlapping. PhD, then mix the medical subjects physio, patho, medicine which are relatable. Then DADH followed by cons, dental material and prosto. Like that, blend subjects, one clinical, one non-clinical, one basic, one clinical, like that. So do that in the morning. And in the evening, do one full paper every day. So the first day I will do anatomy in the morning, and in the evening I will do a November 2023 paper. Always start with the latest paper and go retrograde, go backwards. Okay, November 23 followed by May 23, November 22 followed by May 22, November 21 followed by May 21. And weekly test, like I have said, you have to give weekly test. So on the 7th day, you take a grand test. Similarly, again 7 days you will do something, and again you will take one grand test. For all of you, we have kept 3rd May as the All India Mock GT. It is free for all. Everybody can give for an All India ranking, and you will know where you stand among your peers. That's not your final result, but it gives you a very good understanding of, what to expect further and how to proceed further. If you are better in the morning, do papers in the morning and do theory in the evening. You can change this theory in the evening and papers in the morning according to your liking. You can change it like daily also, that today I will do paper in the morning and theory in the evening, or vice versa. That's your choice. But every day you have to tick one subject. Every day you have to tick one paper. Okay, so like that you will be finishing with all your subjects by 10th May. Okay, if you have enough time, you can go up to 2017 paper, and if you have more time and if you feel you have already done a lot of revisions, you can go beyond 17 also, but at least 6-7 year papers you should do. So 23, 22, 21, 20, 19, 18, 17. That's more than enough. If you have done revisions, you can go beyond. But remember, unless and until you revise everything 3 times, there is no use of that revision. I am assuming that since 1 month is over, since your NEET, you have already done once everything, like the strategy I have discussed previously. This is the finishing touch. So finish your subjects and then start revising. When you start your revision, you can do 2 subjects together. Whatever you're forgetting in the notes part, do anatomy and oral surgery, do ortho and pedo, do pharma with medicine, do prosto with cons endo. I've already given you a list of 12 most important subjects, 6 medical subjects and 6 dental subjects which are the most important in INI. Mostly it is belonging to this category, and finish your 12 subjects twice. Okay. Along with that, you do 2 papers now. Now you already know which questions you are making mistakes at. Do only those questions. Don't repeat the questions which you are very sure about. Mark those questions, bookmark those questions if you are doing it on the app, and do 2 papers together. All the 23 May and November paper together, 22 paper, 21 paper, 20 paper, give 1 weekly grand test, then 19, 18, 17. So by 14th May, you will be finishing 2 revisions, 2 theory revisions of all the subjects and 2 paper-wise revisions of all the papers, or at least the last 7-year papers of the past INIs. And along with that, you would have given 3 grand tests. Anybody, mind you, anybody with a good basic preparation of the subjects who follows this strategy can crack the INI. It needs a lot of dedication. It needs a lot of hard work. It needs at least 8 to 10 hours of study. But after all, it is INI. And it is worth it if you can do it. In the last few days, on 15th and 16th, whatever backlog you have, you can clear that backlog. If you don't have a backlog, the only thing you have to do is PYQ, PYQ, PYQ. In the second revision, whatever you have been forgetting, just revise those questions again and again and again. PYQ is the key to crack INI-CET exam. 1 day before the exam, travel. If your center is in the same city, it is okay. If your center is not in the same city, travel to the city of your exam. Don't travel on the night of 17th or on early morning of 18th. That's a very bad idea. Travel at least 1 day before. If it's a separate city, settle down in that city, take some rest and have a fresh start. Okay, take a hotel or take a place near your exam center and settle down. With that minimal 1 or 2 books or just that app in your phone, just to revise the PYQs that you have been forgetting. And then you are ready for your big day, for your exam day. Now quickly discussing the 3 most important things of the exam. Most important is your PYQs, which is why in the strategy, 1 paper per day. Don't forget this. Next most important thing is the dental subjects. In dental subjects, mind you, 60% of the paper will be from the dental subjects. 60% questions will be easy. When I say easy, that means they are from the repeated topics. Not repeated questions necessarily, but definitely repeated topics. Only 40% paper from the dental subjects will be moderate to difficult. And it will be difficult for everybody. If it is difficult for you, it is difficult for everybody. I don't worry about this 40% at all. I only worry and prepare for this 60%. All those who get a rank in INI, they are 100% correct about these questions. They never make a mistake in the repeat questions. And out of those 40% new questions, make minimal mistakes. Leave that question, get a 0, which is better than getting a minus 1/3. Attempt less than your NEET attempts. It's okay. But when you are sure that this 60% is correct, you have a seat. Similar things goes on for the medical subjects. It takes up around 40% of your syllabus, 40% of your questions in the INI. Around 80 questions I'm expecting from the medical subjects. And in these medical subjects also, there are 6 subjects which are most important, which we have discussed. Okay, anatomy, very important. Pharma, very, very important. General medicine, maybe not very difficult questions, but questions related to dentistry. General surgery, one of the most important subjects in medical subjects. Pharma, or anesthesia, very, very important. And nowadays, a lot of questions have been coming from pathomicro also, image-based questions on pathomicro. They will give you a cell cycle. They will give you the reproductive cycle of the pathogen. They will give you a slide showing the grape-like clusters or something related to image-based questions in Pathomicro. Give attention, more attention to these subjects. And again, like I said, out of them also 60% paper will be easy. 60% questions will be easy. Anatomy, it cannot be tough. It has to be straightforward. At least 60% of it. And we are not bothered about the 40%. Okay? The last most important thing is taking tests. Take 3 grand tests. 3rd May 2024 is the all India free mock. We are already doing a lot of GTs. 4 GTs we have given for you where the explanation is given by the 19th set of faculties. They're explaining each and every question, explaining why this is correct and why this is wrong, free of cost on our YouTube channel DBMCI MDS. Still, if you can't make use of it, I don't know how better somebody can teach you. All right. So make the most of it. All the GTs are live. You get a ranking. And the 3rd May GT is an all India mock. So please give it for the best preparation that you can have. Yeah. So this is about the INI-CET mock, which is on 3rd May. Try to give it between 9 a.m. to 12 p.m. It will be live for 3 days. But still try to give it between this time on the first day itself. This will be the time of the exam. If you give it at 2 a.m. in the night, your body clock is not used to giving a 9 a.m. exam. Give it at 9 a.m. sharp. Sit for 3 hours, take the test. Okay. Worst come, you can do it for 10 to 1. 10 a.m. to 1 p.m. That's the latest you should take any grand test and practice according to the body clock. Your breakfast to lunch period will be between this. You will neither be hungry nor too overfull. So that's the best time to give an exam. That's the best time to take a test. All right. So this is the strategy I have for all of you. Still, if you have any doubts, you're open to asking any doubts that you have. I wish all the best to all of you for your exam.